There's a few things I'd like to highlight. One is we have had a good discussion of the intersection between the public mental health system, the academic systems, and the VA, especially when it comes to taking care of veterans after they're no longer on active duty. And many think the VA takes care of everybody. That's not true. Most returning service members, more than half, do not get any care or only get a portion of their care. So one of the big pushes has been to teach our civilian counterparts. And the beauty of this meeting in Canada is we've also been able to learn from our colleagues about their health system, their returning veterans, and you always learn from comparing different systems. Another piece to this meeting is we have had a focus for several years on personal experiences of psychiatrists in the combat zone, what it's like to deploy. In past years, we've had panels on being a female psychiatrist deploying, and this week, my volume, Women at War, published by Oxford University Press, has just come out, and so that has been a useful platform to talk about the experiences of deployed female service members. I've also just had a book published by the Borden Institute, part of the Office of the Army Surgeon General, on forensic and ethical issues in military behavioral health. And there's a whole host of ethical issues, such as confidentiality, that come up. Talk that we did was also on mefloquine, the anti-malarial, because mefloquine can cause a lot of neuropsychiatric side effects, and that can be hard to distinguish from post-traumatic stress disorder and TBI. So that was another discussion. How do you tell what is due to an anti-malarial agent, Lariam or mefloquine, and what is TBI or PTSD? Another fascinating part of this meeting is my colleague Dr. Mike Camp talked yesterday about U.S. Army psychiatry in Vietnam. He just published a book available again through the Borden Institute, and this is the experience of the psychiatrists who went to Vietnam, often unprepared, often shunned by their civilian colleagues, and how demoralizing it was for them. And it's a story that is only just beginning to be told. So Dr. Camp did a fantastic presentation on U.S. Army psychiatrists in Vietnam. In terms of what military psychiatry can offer, for 100 years we have been innovative on the battlefield, especially in the areas of surgery and of psychiatry. So a couple parts of this. One is the importance of immediate frontline mental health intervention with the expectation that people will do better. Another piece of this is our focus on innovative treatments. We don't need to worry about being covered by insurance, and a real focus on meeting the patient where they are. We know that young service members, usually male, don't really like to come in and talk to a therapist. So how can we do whatever it takes to reach out and meet the service members? And I think our civilian colleagues can learn a lot from that approach. The future of military psychiatry probably depends on what happens next in the global war on terror. Are we going to be going into Syria? Are we going to be fighting ISIS? And it's a little hard to tell what the world will be like 10 years from now. However, we can draw upon the lessons learned from World War I, from Vietnam, from Somalia, and be proactive and flexible. We also draw on the international experience. Another wonderful thing about being in Toronto is having the Canadian experience and other NATO experiences.